all. Pleasure to talk with you all this evening. And I think we're going to have a fun program tonight. We are going to do a little bit of audience participation. So we're going to utilize the chat function a couple times in the program this evening. So if you're not sort of in a place to type a couple letters into the chat, go ahead and get yourself into place. So I'm going to share a couple of slides to start off. And so here's the first slide just with my titles. And we're going to talk about both of these books as mentioned. And we're going to start with the 7 steps to managing your memory. And we're going to go through all these different steps. But we're going to begin by spending a little time going through the preface of the book. And in the preface, I have some common memory scenarios. And what I'm going to do is I'm going to read through these different common memory scenarios. And as I go through each one, if you say to yourself, that's just normal aging, that's just what happens to one's memory as one gets a little older, I want you to type in the letter Y for yes into the chat. If, on the other hand, as I read through a scenario, if you say to yourself, wait a minute, that's not normal, that sounds like it could be the start of Alzheimer's disease or dementia, I want you to type a letter N for no into the chat. All right, so here we go. So you walk into a room to get something and you forget why you're there. What do you think? Is that normal? Why? Yes. Or not normal? No. Well, I want to see a big Y from everyone. That one is normal. Woo, thank God, right? We'd all be in trouble if that one wasn't normal. Okay, let's take a look at this one here. You're having trouble remembering some of the details of your life, such as your wedding. What do you think? Is that normal or not normal? Again, type a Y or an N into the chat. Yeah, this one's a little trickier. This one's a little trickier for sure. Okay, how about this one here? When you are driving and not paying attention, you take one or more wrong turns and you end up somewhere you did not intend to be. Is that normal or not normal? Y or N? And how about this one? You have trouble finding your car in a parking lot. What do you think? Is that normal? Y or not normal? N? I think most people are like, I hope that one's normal, right? And my all-time favorite, your family tells you that you've asked that question before. What do you think? Is that one normal or not normal? Well, it is my job this evening to empower you all with the knowledge so that you will know whether these memory problems and other problems or issues that you may see in yourself or a loved one, whether these things are normal, whether they're not, and most importantly, what to do about them. And to accomplish that, we are going to dive in to the 7 steps to managing your memory. And we're going to begin with step 1, which is learn what is normal memory. And I'm going to give you a filing system analogy as to how your memory works. So let's say there's something that you want to remember, like somebody's name. Well, the first part of our filing system analogy I want to tell you about is our file clerk. Now, a file clerk is actually part of your brain. It's your frontal lobes right behind your forehead. And it's the frontal lobe file clerk's job to take information in from the outside world and to put it into the memory file cabinet. Now, when we want to retrieve a memory, our frontal lobe file clerk walks over to the file cabinet, looks up and down, finds the memory that we're looking for, pulls it out, and we've retrieved the memory. Well, that's good, but guess what? As we all get older, our frontal lobe file clerk is getting older too. And I'm now going to share with you the changes that can happen to our frontal lobe file clerk as we all get older. So again, as an analogy, one thing that happens to our older frontal lobe file clerk is they do not hear quite as well as they used to. What? And because of that, as part of normal aging, information may need to be repeated a couple of times in order for the frontal lobe file clerk to get a hold of it so they can put it into the file cabinet. Now, another thing that happens to our older frontal lobe file clerk is they do not move quite as quickly as they used to. And because of that, it may take a little bit of time for our frontal lobe file clerk to make it over to the file cabinet and to retrieve the memory. Now, the third change that happens as part of normal aging is our frontal lobe file clerk does not see quite as well as they used to. And because of that, you can imagine when they're looking for a memory, scanning, squinting up and down the file cabinet, they may need a hint or a cue in order to find the memory that they are looking for. But importantly, in normal aging, as long as the memory made it into the file cabinet in the first place, it should be able to be retrieved, even if it takes a little bit of time or a hint or a cue. So in a nutshell, those are the changes that we expect to see as part of normal aging. Now, step 2 is determine if your memory is normal. And here we're going to talk about some of the changes that occur in Alzheimer's disease. And we're going to continue with our filing system analogy, but this time we're going to focus on the file cabinet. Now, the file cabinet is another part of your brain. It's called the hippocampus. It's deep in your temporal lobe. So if you put your fingers on your temples, it's just deep in there. Now, the problem in Alzheimer's is that Alzheimer's damages and ultimately destroys the hippocampus. And the way I think about it is, imagine if you pulled open that file drawer and you look down inside, you would see a big hole in the bottom of the file cabinet. Well, if there is a hole in the bottom of the file cabinet, you could have the best, most efficient file clerk in the world, pulling information in from the outside world, putting it into the file cabinet. But what's going to happen? It's going to disappear down the hole, never to be retrieved again. And when that happens, even when information is repeated, even if you wait a bit of time or give a hint or a cue, the information cannot be retrieved. And when that happens, we call it rapid forgetting. And rapid forgetting is never normal. It should always be evaluated. Let's talk about some of the other problems that occur in Alzheimer's disease. And one of them is getting lost. But anybody of any age can get lost, right? You make a wrong turn, something doesn't look familiar, bam, you're lost. But what do we all normally do? Well, you can pull out a map from your glove compartment, or this day and age, probably more likely from your phone. You can use a GPS device, or you can pull over and ask for directions. And using any of those methods, you're back on your way. But the problem in Alzheimer's is that paper maps and phone apps and GPS devices are complicated and confusing to use. You can pull over and ask for directions, but they're often long and detailed and hard to remember. And it's for those reasons that people with Alzheimer's have such difficulty getting lost. Let's talk about another problem that can come up, which is losing things, misplacing things. But you know what? Losing things and misplacing things is also pretty common. I want you to type a Y in the chat. If you have misplaced your keys, glasses, wallet, pocketbook, cell phone in the last year, has that happened to anyone? Yeah, me too. So if you're losing things, if you're misplacing things, how do you know if it's normal? Well, listen, if you're someone who every morning, all your life, you spend 5, 10, 15 minutes, hunting around the house, trying to find things. And, now you're getting a little bit older and you're still spending 5, 10, 15 minutes hunting around the house looking for things. Well, guess what? That's probably normal for you and not something to worry about. But if on the other hand, you were somebody who was always very organized, always knew exactly where everything was, never had to hunt around for things, and now you're spending not only 5, 10, 15 minutes, but maybe 20 minutes or an hour hunting around the house looking for things. Maybe you had to cancel the credit cards because you never did find that wallet. Maybe you had to buy a new cell phone because it never did turn up. Well, that could be a problem. So the point I'm trying to make here is it's not only what the problem is, but also whether it represents a change from the way things used to be. Now, the last thing I want to mention in this section is about repeating questions and stories. Now, anybody can be halfway through telling a story to a close friend and you say, oh my God, I told you this already, didn't I? And anybody can forget the answer to a question and ask it again. But when there is a pattern of repeatedly asking the same question to the same person again and again and again and again, or telling the same story to the same people over and over and over again, that is not normal. That's usually due to that rapid forgetting that we were talking about. And rapid forgetting is never normal. It should always be evaluated. Okay, so we are going to continue now with step 3, which is understand your memory loss. And we are going to talk about the question that I get asked more than any other, which is, what's the difference between dementia and Alzheimer's disease? It's very straightforward. Dementia is a general category that simply means there is a decline in thinking and memory that is sufficient to interfere with day-to-day function. And the way I think about this general term dementia, I think of it like I think about another general term like a headache. Now, a headache can be from a lot of different things. You can have a muscle tension headache or a migraine headache, neither of which are very serious. But you can also have a headache from a stroke or a brain tumor, which obviously are serious. And with dementia, it's the same way. You can have dementia from something as simple and as treatable as a vitamin deficiency or a thyroid disorder. But you can also have dementia from a variety of different brain diseases, including Alzheimer's disease, frontotemporal dementia, vascular dementia, which is dementia due to strokes, Parkinson's disease dementia, which is similar to dementia with Lewy bodies, and there's many other types as well. So dementia is the general category, and Alzheimer's is one type or one kind of dementia. Got it? All right. So now we're going to talk about another term some of you may have heard of, which is mild cognitive impairment. So mild cognitive impairment is present when there's three things. The first is someone is concerned about their memory. It can be the individual themselves, it can be their family, or it can be their doctor. The second thing is that when the individual undergoes pencil and paper testing, yes, indeed, a problem is found. So the concern is confirmed by the pencil and paper testing. But the third thing is that their day-to-day function is normal. If their day-to-day function is normal, then by definition, they do not have dementia. Now, the studies show that if you follow people with mild cognitive impairment over time, about half of them do end up declining and developing either Alzheimer's disease or another cause of dementia. But that also means the other half don't. The other half either stays stable over time or their memory actually improves. You might say, how does anybody's memory improve over time? Well, if the memory problems were due to depression, low mood, when their mood lifts, their memory can improve. Another common cause of memory problems are medication side effects. And if the individual works with their doctor and the medications get adjusted, their memory can improve. Okay, so now we're going to move on to step 4, which is treat your memory loss. And we're going to talk about the FDA-approved medications to treat memory loss in Alzheimer's. But before we launch into those, I need to tell you a little bit more about Alzheimer's disease so you understand how the medications work. So we believe that Alzheimer's starts with an accumulation of a protein called beta amyloid. The amyloid clumps and clusters together to form plaques. The plaques get bigger and bigger until it starts to damage the neighboring brain cells. Inside the brain cells, a protein called tau gets loose, and the tau is very sticky and sticks to itself, and it forms these long chains, and the chains get all tangled up. So these are the plaques and the tangles that you might have heard about in Alzheimer's disease. Now, once the tangles form inside the cells, it kills the cells. And the cells are normally making chemicals, neurotransmitters, that allow different parts of the brain to talk to one another. And one of the most important chemicals for memory is acetylcholine. So in Alzheimer's disease, the levels of acetylcholine drop. It's for this reason that the mainstay of therapies for Alzheimer's disease are medications that can help to raise up the levels of acetylcholine. These are medications that I bet many of you have heard of. These include donepezil, whose brand name is Aricept, rivastigmine, whose brand name is Exelon, and galantamine. All of these medications help to raise up the levels of acetylcholine. Now, from the perspective of the individual and their family, what these medications can do is they can turn the clock back on memory loss by 6 to 12 months. So what I mean by that is that when I write a prescription for one of these medications and I give it to a patient, I can make their memory like it was 6 months ago or even a full year ago. And the earlier they come to see me, the more likely it is that I can turn that clock back by a full year. And there's a very simple reason why. there are more brain cells which are likely still living that the medication can work on. Now, I talked about being able to turn the clock back, but I cannot stop the clock from ticking down. So what that means is that when I see someone, 2 years, 3 years, 4 years later, yes, it's true, they are going to be worse off than when I first saw them. But that does not mean that the medication is no longer working. As long as they had that good initial turning back the clock response, it's almost certainly still working. And we want them to continue it, because if they stop it, they will plummet 6 to 12 months worth of memory function in 1 to 2 weeks. Okay, so if someone had a good initial response to these types of medications, we want them to stay on it pretty much forever. All right, now, wouldn't it be great if we had a medication that could actually slow down that ticking clock? Well, there's nothing, in my opinion, that can do that yet, but there are a lot of medications that are out there that are in research. They're doing clinical trials to see if they can help. And many of these work at removing either the plaques or the tangles from the brain. One medicine called aducanumab or Aduhelm has tried to do this by removing the plaques. But unfortunately, in my opinion, as well as that of the FDA's advisory panel, this medication does not succeed in helping people to improve their thinking and memory or slow down Alzheimer's disease. But we're very hopeful that a medication will be developed soon that can do that. Now, there's other medicines that don't work, and these include Prevagen, curcumin, which is found in curries, ginkgo biloba, resveratrol, other medicines on this slide. None of these medications have been proven to be beneficial in my reading of the scientific literature. Okay, so what does work? Aha, so in addition to the cholinesterase inhibitors, medications like donepezil or Aricept, step 5 talks about things that work related to modifying your lifestyle. And one thing that works is eating a Mediterranean menu of foods. So as you can see, the Mediterranean menu includes fish, olive oil, avocados, fruits and vegetables, nuts and beans, whole grains, and from a sister diet, we pull in poultry, okay, like turkey and chicken. And so these are the things that over 7,000 studies have shown are good for brain health. So you're all probably saying, okay, well, that's great, but what are the things that are not good to eat? Well, I hate to tell you, it's almost everything else. So red meats, fried foods, fast foods, butter and margarine, pastries and most sweets, white bread, white flour, white rice, sugar sodas, diet sodas, sugar juices, diet juices. All of those foods I put in the category of once in a while foods, not every single day foods. Now, before everybody gets really depressed and thinks, oh my God, I can never have dessert again, I did want to remind you that chocolate in small amounts has been shown to benefit thinking and memory and mood. You just have to remember that it's what type of chocolate? That's right, dark chocolate. The darker, the better, because it's the cocoa that's actually good for you, not so much the butter and the sugar and the milk that they put in it to make it sweet and creamy. All right, now, everyone knows that exercise is good for you, but I will bet you that I can tell you at least one new thing this evening about just how good exercise is for you and why. But I do have a word of caution. If I inspire you this evening, before you lace up your jogging shoes and say, I don't care how dark or cold it is outside, I'm going to go running right now. Before you run out the door, I do want you to check with your doctor and just make sure that your heart and your lungs and your bones and your joints are ready for whatever increased exercise you're going to do. But having said that, there's exercise that everyone, just about everyone, can do. And many of the studies that I'm going to talk about actually looked at brisk walking as their exercise of choice. Now, the recommendations are that you do at least, note that I'm saying at least 30 minutes a day, 5 days a week of aerobic exercise. And to remind you, aerobic exercise means it's exercise that gets your heart beating quickly, gets you breathing heavy. That's how you know it's aerobic. Also recommended are 2 hours each week for exercise that helps with strength and balance and flexibility. So these are things like yoga, Tai Chi, Pilates, and isometric weightlifting. All right, let's talk about some of the benefits of exercise. Well, everyone knows that exercise reduces your risk of heart disease and strokes, but it's worth commenting on because strokes are a major cause of memory problems. Exercise also reduces your risk of falls. And if you fall and hit your head, you can injure your memory too. Exercise is also a natural antidepressant. And in fact, it's better than many antidepressants that are currently being prescribed today. Did you know that exercise also improves your sleep? Well, you might say, well, that's good, but what does sleep have to do with memory? Turns out sleep has a lot to do with memory, and I'll tell you 3 of the reasons. So the first is that if you don't get good sleep at night, you're generally tired the next day. And if you're tired, it's hard to pay attention. And if you don't pay attention, you can't learn new memories well. The second reason is that we all make a little bit of this beta amyloid protein during the day, but we normally clear it away while we sleep at night. And the third reason is that sleep helps us to keep our memories for a lifetime. Now, we talked earlier about how the hippocampus is the part of the brain where all of the new memories are formed and where they're initially stored. But it turns out there's another part of the brain where all the older memories are kept. And this transfer process from the new memory file cabinet to the older memory file cabinet takes place while we are sleeping. So we need to get good sleep in order to allow this transfer process to take place. But the most exciting thing that I want to tell you about the relationship between exercise and memory is that exercise releases growth factors in the brain that actually helps us to grow new brain cells. And guess where there are more brain cells growing from exercise than anywhere else in the brain? Yes, you guessed it, in the hippocampus. And this effect is so powerful that even in older adults, you can see the change on an MRI scan in as little as 6 months. So people sometimes ask me, Dr. Budson, isn't there some magic bullet out there that can really help my memory? I answer, yes, there is. Exercise truly is the magic bullet. Okay, now we're moving on to step 6, which is strengthen your memory. And I'm going to answer another question that I always get asked. Do those computerized brain training games or crossword puzzles or Sudoku, do those help you to improve your memory? Well, the answer is that if you spend time doing crossword puzzles or Sudoku or brain training games, you will get better at crossword puzzles and Sudoku and brain training games. It simply does not translate to overall brain memory or cognitive function. But there are some things that do help, and I'm going to talk about them now. The first thing I want to mention is that social activities are really good for your brain. And we think it's because this is one of the very important activities that our brains evolved to do. They evolved to participate in social interactions. Now, another general thing that's good for your brain to do is to engage in novel, stimulating cognitive activities, such as taking up a new hobby, doing an adult education course, learning that language you've always wanted to learn, reading a nonfiction book. If you play a musical instrument, that will count if, in addition to playing the tunes you've played for a long time, you learn new tunes or maybe a whole new genre of music. And the third thing I want to tell you here is that although it sounds like pop psychology, keeping a positive mental attitude is actually really important. And we think it works for all the obvious reasons. People who have a positive attitude are much more likely to be social and outgoing. People who have a positive attitude are more likely to take care of themselves, eat right, and exercise. But what about those brain training games? Well, they're coming out with new ones every day. Maybe one of them will be beneficial, but there just isn't evidence for it yet. But I'm sure it's better than watching TV. Now, the other thing that we have written into the book are all sorts of different strategies that you can use for specific situations. So we can teach you how to pay attention better, how to make connections between the new thing you're trying to learn and things that you have already know, how you can use visual images to augment your memory, how you can create your own memory palace for remembering information. You can invent catchy rhymes to remember things in the nick of time. You can learn to remember people's names that you've met at a cocktail party, or also retrieving someone's name that you've known for 30 years, but are having trouble coming to mind with. So we have strategies for all those different things and more. We also talk about a number of different memory aids that can be helpful. Things to help remember where you put your keys by putting it in the same place every day. Use a pillbox, use calendars or planners, notebooks, lists, smartphone apps, all sorts of different memory aids that everyone can use. Now, step 7 is plan your future. And here we talk about, like, what do you do if you're having some memory problems? How do you keep working? How do you keep driving? How do you keep doing your hobbies? And how do you do all these things safely? We also talk about, how do you know when it's time to retire from that job? How do you know when is it time to hang up the keys and let someone else do the driving? So those are the 7 steps to managing your memory. And now we're going to spend a couple of minutes about the 6 steps to managing Alzheimer's disease and dementia. And I'm again going to read from the preface of the book so you get a sense as to the types of problems that we cover here. And this is obviously just a taste of the problems. And as I read off these problems, if these resonate with you, feel free to type a Y into the chat. Here's the first quote. These are quotes from families that I've worked with. I always thought I had a lot of patience, but if he asked me what we are doing today one more time, I think I will scream. He wants to drive, but I don't know if it's safe. I've never fooled around in my life, and now, at age 83, my wife is accusing me of having an affair. It's happening every evening now. She keeps saying that she needs to go home, but we are already home. When I came home from the hairdresser, he asked me who I was. He really didn't recognize me. So I don't know if that resonates with some of you, but we cover these and many other types of problems that caregivers face when their loved ones have dementia in this book. And like I said, we're going to spend a couple of minutes going through some of these issues right now. We're going to cover all these different steps. The first step, step one, understand dementia. We talk about the difference between Alzheimer's and dementia, like we talked about before, and the other disorders that can cause dementia, but in a little bit more detail than we talked about in the 7 Steps book. The heart of this book is how to manage problems without medications. And we begin with general approaches that can be used, and then we talk about how to manage problems with memory and language and vision and emotions and behavior and sleep and bodily functions. And we're going to go through these quickly right now. And to begin with, I'm going to tell you about one of our general approaches, which is called the 4 R's. So let's say that our loved one is like pulling on the door, trying to leave the house, and they're saying, I need to go home. I need to go home. And, what you really would like to say is, honey, stop pulling on the door. You're already home. Give it a rest. But we sort of know that's not the right thing to do, right? So what do? Well, start with the first R. Reassure them that everything is okay. Second R is reconsider things from their point of view. Although you know that your loved one is home, they may be thinking of a home they grew up in or another home they lived in a long time ago. And maybe that's what in their mind they're trying to get to. So in their mind, it makes perfect sense. So reconsider things. Redirect your loved one to an activity that is both calming and is also distracting. So they will stop being focused on the front door or whatever it is that's upsetting them. And the 4th R is for us as caregivers to take in a deep breath and relax. Because if we are feeling irritated or irritable or frustrated or angry, we are going to reflect that emotion back to our loved one. And we often will just escalate the situation. Okay, so after some of these general approaches, where we talk about how you can break down behaviors, looking at the antecedents, behaviors, the consequences, we then talk about how to manage all sorts of more specific types of problems. So we talk about how to manage all sorts of memory problems, including if people are having trouble remembering to turn the stove off. Well, we advocate for practical solutions. You can unplug the stove, take the knobs off the stove. You want to make sure that you don't come home when the house is burned down, right? So practical solutions. One of the things that comes up if somebody is trying to leave the house is they might wander off if the door is left unlocked. And before they leave the house and wander off, make a plan for wandering. The time to make this plan is not when your loved one is who knows where. You want to make the plan ahead of time so you'll know exactly what to do. Now, something that happens very common in almost all type of dementias is that people end up having false memories. They actually believe things that never happened. And part of our advice is don't fight the false memories. Just go with them. Say, yes, yes, right. Yes, I remember. Right. Yes, you went to the moon last week. Absolutely. Yeah, no problem. But here, let's talk about what I did today. You want to just try to, direct them to a more reality-based conversation, but don't have a big argument with them about what they did or didn't do. It's not worth it. And reminding people that they have memory problems, it's rarely helpful. You know, I get a lot of families to say, he doesn't remember that he has memory problems. What should we do? As long as he's not doing something that is getting him in trouble, don't worry that he doesn't remember he has memory problems. Okay. We also talk about language problems. Almost every dementia has trouble finding words, and eventually people have trouble comprehending, people have trouble understanding language as well. Well, you want to make sure the simple things are covered, check their hearing aids, things like that. And don't forget that you can use pictures to communicate with someone even when the language has broken down. And also remember that your tone of voice, your facial expression, and your body language is a good way to communicate with your loved one when they can no longer understand the language that you're using. Okay, vision problems are also very common in Alzheimer's and other dementias. People often have trouble recognizing family members. They may think that one family member is another. They may think a child is a spouse, or they may think a spouse is a parent. You know, this is very common. Less common, but still comes up. Sometimes people think that you are the family member, but that you've somehow been replaced by an imposter. So they say, you're not the real George, or something like that. People can have vision troubles for ordinary reasons, of course. You want to check their eyes and check their glasses if they're wearing glasses. And simple things like increasing the lighting, increasing the contrast can often do a world of good. We also talk about how you can reduce the impact of hallucinations. Even if they can't be eliminated entirely, you can reduce their impact. We then talk about managing emotional problems, how you can treat anxiety and depression, and why these things come up so commonly in Alzheimer's disease and other dementias. Now, a big chapter in the book is how to manage behavioral problems. We talk about managing driving. You know, what do you do about that? How do you get people to stop driving? When should you have people stop driving? Talk a lot about those issues. We also talk about how to deal with aggression, agitated behavior, combative behavior, inappropriate behavior. And part of it is really understanding, like, what is the cause of the agitation? You always want to look for medical problems, right? Could they have a urinary tract infection or pneumonia or the flu? Maybe that's why they're having problems. We talk about home safety, like making sure that guns and power tools are locked up or given away. And we talk about planning around sundown. So for example, the holiday season is upon us, right? If you're planning on having a holiday celebration starting at 6 o'clock, and you know that your loved one does terribly starting around 5 p.m., well, if you want your loved one to be part of that celebration, plan around the sundowning. Don't start your activity at 6 p.m., start it at noon. And that way your loved one can participate when they're at their best. Don't argue with jealousy and paranoia. It never works. Try the 4 R's, or try soothing and familiar music. Or you could try real pets, robot pets, or stuffed animals that can also provide comfort. Sleep problems are huge. I had a family member tell me yesterday, that she said, doctor, you gotta give me a sleeping pill for my father. He's up at 4 a.m. waking everybody up. So I respond, well, okay, let's just take it slow. Tell me a little bit about his sleep cycle. So what time does he go to bed? Oh, we put him to bed at 8 o'clock. So I'm adding up the hours. If he goes to bed at 8 o'clock, By 4 a.m., he's had 8 hours of sleep. So no wonder he wants to get up at 4 and get on with his day. He's well rested. And for that family, it was nothing more complicated than that. We had him go to bed at 11, got up at 7, fixed the problem. Okay. We talk about how you can help with sleep habits, how you can look for a medical sleep disorder, because they're pretty common in older adults in general, and how you can use melatonin for sleep cycle disturbances. Melatonin doesn't fix all sleep problems, but it does help people adjust their sleep cycle. Okay, there's so many different problems that come up with bodily functions. And we talk about how you can improve walking and reduce falls with all sorts of different strategies, how you can reduce incontinence during the day, and how you can also reduce incontinence at night. There's simple ways to treat tremors and allow people to eat and drink without spilling their food. And all sorts of different bodily functions can be helped. Now, step 3 is ask about medications. And here we talk first about the medications that can cause trouble. There's so many different types of medicines that can cause trouble. And I'm really pleased that our editor let us put in these sort of lists and lists of medications, both the generic name and the brand name of medications that can actually make things worse. So the idea is don't just stop them, but talk with your loved one's doctor about whether they can be stopped or another medicine can be given in their place that doesn't have bad side effects, or can at least the dose be reduced. We mentioned how alcohol is going to impair one's memory. One drink a day is not permanently going to damage the memory, but don't kid yourself. Even one drink will impair the memory. Okay. Now, if you want to give a new medicine to help, we really encourage you to track it, make sure that you know if it's helping or not. And we have some general strategies that we recommend in terms of how to help the memory. We recommend you start with enhancing cognition. So these are medications like the donepezil, the Aricept that we were talking about before. The next thing we try are medications to help people feel more calm. So these are things in the Prozac family of medicines, the so-called SSRIs. And my favorites are sertraline, brand name Zoloft, and escitalopram, brand name Lexapro. But there's other things that can help in this category as well. And then finally, if those other approaches don't work, we sometimes use more powerful medications to suppress behaviors. Okay, now step 4 is build your care team. And we start with the most important member of the care team, which is you, if you are the primary caregiver. And my co-author, Dr. Maureen O'Connor, who wrote this section of the book, she has a wonderful saying, which is, you can't pour from an empty cup. And so she talks about all the different ways that caregivers can care for themselves, including eating right and exercising and taking care of their own medical problems and sleeping well and taking time for themselves. We also talk about all the different ways to engage friends and families and neighbors, all the different things that they can do to help, how support groups can be helpful. And don't forget, professional caregivers, respite care, day programs, the Alzheimer's Association, and the doctor, hopefully, will be part of the care team too. In step 5, sustain your relationship, we talk about how and why relationships change in dementia, how you need to take the lead to get an activity going that can help to sustain your relationship with your loved one. It's important to plan ahead. You want to start small and build up, and you often have to go with the flow. And the important thing is don't give up. If it doesn't work, try a different plan. And there's so many different ways that you can sustain your relationship with your loved one, even if it means modifying the way you used to do an activity like this. Finally, step 6 is plan for the future. And we talk about, the sort of practical things that, people often think about here, like medical legal issues, financial legal issues, protecting your loved ones from scams and con artists. But then we also talk about some more difficult issues, like how do you know when it might be time to move out of the house or have more help within the house? How do you make a transition so it goes as well as possible? And what do you do if your loved one refuses to do any planning? Then we continue by talking about some things that, again, are often difficult conversations for families to have, but everybody wants to know about it. Things like the funeral, the ceremony, the death itself, what's hospice and palliative care mean? What does it mean to be dying from dementia? And talk about other issues like the body, and how do you sort of get on with your own life after your loved one is gone, if you've been the main caregiver for several years. So those are the 7 steps to managing your memory and the 6 steps to managing Alzheimer's disease and dementia. And if you're interested in more information, you can check the books out of the Mansfield Library or another library near to you. You can, of course, get them through your local bookstore, which I always want to support. You can get them through your favorite online retailer as well. I also have a couple blogs. I have one on Psychology Today and one on Harvard Health. I have a website that you can check out that actually has some news articles that might be of interest to you as well. And feel free to just reach out and email me if you like. Okay, so I'm going to end it there, and I would love to answer any questions that anyone has. So you may type questions into the chat, or if you would like to, I am perfectly comfortable with you just unmuting yourself and shouting out the question. So either is fine with me.
Doctor, my wife is in a nursing home, and one of the things that comes up is begging me to come home every time. She's been there 15 months, promising to do better, thinks she's getting better. And I know that I'm supposed to try to redirect her, but I just don't have very good skills for doing so. Any quick thoughts?
Yeah, that can be a very difficult situation. And I think that one approach that has worked with some of our families is to just sort of say, look, this is just like your new room where you're sleeping, and I'm here in the evening. I'm going to come back tomorrow morning. I just need a little bit of help from the people here to help to get you sort of ready for the day, and I'm still here with you. So that may help a little bit. The other things that are sometimes helpful is to just see if you can engage in some type of activity that she enjoys doing, whether it's listening to music or watching some old movies or looking through a photo album, or maybe she can't play cards anymore, but maybe if you used to play cards, she can watch you play solitaire and help out a little bit or something like that. But I acknowledge that's a difficult situation.
Thank you.
Other questions? And again, feel free to type them into the chat, or you can just unmute yourself and ask your question.
Well, I'll follow up with one more.
Sure.
My own doctor has suggested that perhaps I visit less for my own sanity. Any thoughts about that?
Yeah. So how often do you go?
Every 2 to 3 days, sometimes more.
And how long do you stay when you're there?
I found that the visits work best when they're kept short.
Mm-hmm.
Half an hour, 45 minutes, hour to an hour.
Mm-hmm. And what happens if you stay longer?
That's when she starts to say, can't I go home? I know
Okay.
I'm better now.
Yeah.
I have been trying new things. I tried actually working on a coloring book with her today. I
Good.
haven't colored in 60 years, but
And did that go well?
she has a lot of trouble with motor control now. So
Yeah.
it was hard for her. So
So you might try modifying the activity. So maybe you do the coloring and you can ask her, what color should I make this? And what color should I make that? And
I tried that.
yeah, you sort of do it together. It is tricky. This next question is a difficult one here. Can a dementia patient target certain family members to abuse them? I'm sorry, I don't understand what that question means. If you could elaborate, either talking or in the chat, I'd appreciate that.
Oh, okay. So my question is primarily my mom targets my sister to abuse verbally or,
you mean your mother is verbally abusing your sister? Is that what you're saying?
Yes, but she's not doing it to other family members. So we're a little confused as to what's going on here.
Yeah. So that happens sometimes. And obviously it can be very hurtful to the person who's targeted. Sometimes that arises because there's a false memory that it's possible that your mother, like, I'm just making something up, but it could be something like this. Let's say she watches something on TV and there's a character who looks a tiny bit like your sister, and your mother somehow gets it into her head that the character who did something bad was your sister. And now she has this whole thing that your sister is bad and should be yelled at or whatever is going on. That's sometimes the reason that can happen.
So it makes
and hold, I do have a suggestion of what to do in this situation. So if it's something like this, or even if it's something different, it sounds like your mother has associated sort of a negative valence, a negative emotion with your sister. And the best things to do would be sort of like what you would do if you had like a huge argument, like, with a friend or a family member. It's like, what do you normally do in that situation? Well, you could try talking, that might help. But the other thing that helps is just spending time together to sort of establish good feelings and good memories and things like that. And so what I would recommend is to work on having, your sister spend time, do activities with your mother that she enjoys, whether it's, I don't know, painting her nails, giving her a massage, spending time, watching TV together, whatever it is, playing cards, I don't know, to try to sort of overcome the old feelings and replace them with new feelings. That's what can be helpful.
No, unfortunately, in this case, they've walked, or my sister has walked away. She's done.
Well, and that can happen. That can happen, but
The cup is empty.
right. Well, if your mother has dementia, we can't expect her to behave rationally, right? So that's, I can tell you something that happened in one of my patients. The individual had 3 children, and the 2 of the children are still recognized by the mother, and the 3rd one is not recognized. And the 3rd child took this as like an insult. My mother never loved me, and also had a thing where she walked away. But the fact of the matter is, the 3rd child has a totally different hairstyle and appearance than they did when they were younger. And the other 2 children basically look like identical that they did when they were 10 years old. And I think it's simply that the mother doesn't recognize the 3rd child because she looks totally different, And in that situation, we were actually able to improve things by the 3rd child actually sort of putting on a wig and said, "Look, Mom, it's really me. I'm the same person." And that actually helped.
Wow.
But not everybody, wants to go there.
Right. Thank you.
Other questions? You're asking tough questions, you all.
Hi, this is Linda.
Go ahead.
My dad had an issue like that with my sister. And we finally figured it out that as she got older, she looked so much like my mother's sister, who was very domineering and protective of her sister. And that's where all the resentment came from, because of how she looked. I think that he thought it was her.
Thank you, Linda. That's very helpful. And things like this happen all the time. So thank you for sharing that. Other questions or comments? Well, hearing none and seeing none in the chat, I want to thank everyone for spending time with us this evening. And I'll turn it back over to our host.
Yes, thank you. Thank you so much, Dr. Budson, for presenting this. I do want to let everyone know that both of Dr. Budson's books are at the library. So yes, so please come in and check them out. And again, thank you so much. This is it's such an important topic, and it affects so many people, so many families. So learning as much as we can about how to cope with it and to cope as caregivers is just incredible. So thank you very much.
It's been my pleasure. Thanks very much, everyone.
Thank you all. Have a good night.
Bye-bye.
Thank you, Whitney.
Thank you.